When we think about the health field, our minds are automatically directed to the doctors and physicians who work endless hours in an effort to save lives. However, what we do not think about are the corporate crimes that are hidden behind this seemingly noble profession. Do we really know what is happening behind closed doors? Physicians abuse their power to take advantage of their patients and instill a sense of fear to ensure their silence. When it comes to sexual violence, the mindset of our society is automatically turned to the scandals occurring in the Catholic Church and with celebrities. However, we never think about the sexual abuse occurring in our own local hospitals. The police department has limited funding and cannot afford to waste any time or money looking into a doctor accused by only one person of sexual offense. However, while police departments wait for more complaints to come in, the higher the chance another patient will fall victim to sexual violence. The problem with this is that many victims are very reluctant to file complaints. What is even more frustrating is that when the police department collects enough complaints of sexual violence from patients, the only consequence a doctor faces is being stripped of his or her license. When a citizen is guilty of sexual assault, he can be sentenced for up to 20 years in prison with a $10,000 fine. Does our society see doctors as above the law? If a doctor and a local criminal commit the same crime, why do their consequences differ? Doctors take the trust they have built with their patients and abuse their power by taking advantage of their patients. This leaves the patient broken and alone without anyone to turn because no one is going to believe their accusations against the local trusted doctor. A very recent and well-known example of a doctor who kept hundreds of patients quiet for decades would be Larry Nassar, the doctor for the Olympic gymnastics team. Larry Nassar molested hundreds of girls over the 3 decades with his position as an athletic trainer and doctor for gymnastic camps and eventually the U.S. Olympic gymnastics team. Nassar's popularity grew very quickly, and the institutions that gave rise to his fame failed to put sufficient checks in place to protect the children in their care. Even with several complaints from gymnasts from as early as 1978, no investigation was ever fulfilled until 2016. The only positive that came out of this scandal was the Me Too movement that gave abused women and men the voice to speak out against their predators. It is bad enough knowing that there are physicians in our own country committing sexual assault in our local health facilities, but what we don't realize is that too many of these doctors are working the system by crisscrossing the U.S.-Canada border in order to hide their scandalous crimes and keep their license. Canada does not have the public records of doctors who have committed sexual assaults because their privacy laws prohibit them from sharing such details with the public. Doctors convicted of sexual assault in Canada can easily come to the United States and work as a licensed physician without anyone knowing of their criminal record. Aside from doctors abusing patients, we cannot forget that in many cases, patients are the predators who abuse the doctors and nurses. 45% of nurses have fallen victim to sexual harassment and assault from their patients, ranging from obscene comments to rape. Nurses also have to worry about sexual violence from the doctors who overlook them as well. Our society needs to find their voice by replacing shame with courage and speaking out against the effects of sexual violence in order to put an end to their sexual predators. We need to implement stricter laws to guarantee the safety of both patients and nurses by ensuring that every doctor passes regulations and that inspection is enforced after any complaint is filed. No one should have to keep their abuse a secret. Sexual violence in the health field is a very serious issue that breaks the trust between physicians and patients and must be put to an end in order to ensure the safety of future victims.